Alright, so as you can see here, we have a lot of items here. When you go into your practicals test, you're going to notice a lot of items strewn on the floor. You can feel free to ask any questions that you'd like. So if I'm confused and I'm used to something different, I can say, what is this right here?
It's manual suction.
It's manual suction, okay? So I can go around, I can ask every item I want. I wouldn't do that, you might irritate the instructor, but that's your prerogative. So another tip is to get everything in order. So I know I'm going to use an OPA pretty soon. I might get that in the front. I'm not going to take the time to do that right now, so I don't waste your time, but it's just something to keep in mind. Okay? So the biggest key here is verbalizing everything. So I'm going to start from the beginning. Can I get my dispatch, please?
You are dispatched to the scene of a 19-year-old female ejected in a motor vehicle accident.
BSI, is my scene safe?
The scene is safe.
So the mechanism of injury here is trauma from a motor vehicle accident and an MVA. Are there any other patients?
This is your only patient.
All right, I'm calling ALS for backup, and I'm starting C-spine immediately. All right, I'm maintaining stability of the spine. I'm going to hand that over to my partner on 1, 2, 3.
Consider it done.
Consider it done. Excellent. My general impression of this patient is poor. Now I'm going to assess for responsiveness. Hello, ma'am. Are you okay? Are you okay? No response to verbal stimuli. Now I'm going to initiate painful stimuli. There seems to be some kind of faint verbal response. I'm just going to note that. So the chief complaint here seems to obviously be trauma. I'm looking for any apparent life threats. And when you go into your practicals test, you just rip off the clothes of your patient. I'm not going to do that right now for her sake, but just imagine, or don't imagine. You do that to a dummy, all right? So you rip off the clothes, and I'm looking for any apparent life threats. Do I see anything apparent?
You notice paradoxical motion of the chest when the patient is breathing.
Okay, paradoxical motion of the chest. So if you remember from your type 1 level trauma sheet, that's indicative of a flail chest. So I don't have bilateral motion. Do I notice any kind of injury to one side in particular?
There seems to be bruising on the right side.
Bruising on the right side and paradoxical motion means it's going to be a flail chest. So I'm going to get a bulky dressing. I'm going to apply it to the affected side. I'm going to use it. I'm going to tape it to the unaffected side, kind of like a splint for your chest. Do I notice any other apparent life threats?
There's an open femur fracture on the right leg that's spurting arterial blood.
Open fracture on the right femur, okay? So this is a really dangerous injury, obviously. So I'm going to get a sterile dressing soaked in saline solution. I'm going to apply it directly. Is the bleeding controlled?
Bleeding is not controlled.
All right, I'm going to do that again. I'm going to get a sterile dressing soaked in saline solution. I'm going to apply it. Is the bleeding controlled?
The bleeding is not controlled.
Okay, now that I've tried twice, I'm going to get a tourniquet. Now, I don't want to step over the patient. I'm going to walk around. I'm going to get this tourniquet right here.
Consider it done.
All right. A lot of times you just had to verbalize things. So, are there any other life threats?
None noted.
Excellent. So now I'm going to move to the airway portion of the trauma assessment. So I'm going to open the airway using a jaw thrust maneuver. You can imagine I'm doing that. Don't want to hurt Freya too much today. So I'm going to open the jaw thrust maneuver, looking in the airway. Do I notice anything in the airway?
The airway is full of secretions and vomitus.
Excellent. So I'm going to get a suction catheter, either manual or automatic, depending on the questions I asked earlier.
Consider it done.
Consider it done. Excellent. Is there anything in the airway now?
The airway is now clear.
All right. I'm going to get my partner to maintain that open airway. And I'm going to insert an OPA because this patient is unconscious and unresponsive. So I'm going to insert that OPA. Oropharyngeal airway, it's going to be fancy.
Consider it done.
Excellent. Consider it done. So now I'm going to assess the breathing. So what is the respiration rate? What is the quality of the breathing?
The quality of the breathing is labored and the respiration rate is 6 breaths a minute.
Okay, so if you know from our type 1 level trauma sheet, that is indicative of needing a bag valve mask. So I'm going to get my bag valve mask. And I'm going to administer breaths at a rate of 1 every 5 to 6 seconds while attached to oxygen, high flow oxygen at 15 liters per minute. And I'm going to hand it off to my partner.
Consider it done.
Excellent. So I'm going to look at the chest, look for any further injuries. I know there's a flail chest there already. Looking for any other injuries. Is there any other injuries to the chest?
None noted.
Okay. Now I'm going to move on. I'm going to move on to the circulation portion. So the first thing I'm going to do is I'm going to check a pulse. So I'm going to check a radial pulse. Do I feel a radial pulse?
No radial pulse.
Noted. I'm going to feel for a carotid pulse.
There's a carotid pulse, weak, thready, 60 beats per minute.
60 beats per minute, weak and thready. Okay, that's noted. Also, I'm going to assess the skin. What is the skin condition?
Skin is cool and clammy.
Skin is cool and clammy, that's signs of shock. So I'm going to continue giving high flow oxygen, and I'm also going to give the patient a blanket whenever possible to retain that warmth. Okay, now I'm going to do a blood sweep of the whole body, assessing for any kind of blood. Looking for any kind of blood.
You notice dark red oozing blood from the right shoulder.
Dark red oozing blood from the right shoulder. So, bleeding, you either have bright red and spurting, dark red and oozing. Bright red, you want to fix that immediately. It's a major life threat. Dark red and oozing, just like noted. So that's noted. I'm going to continue the blood sweep. Don't want to step over the patient once again. Do I notice any other blood?
None noted.
Any other bleeding? Excellent. So now that I've already treated for tons of signs of shock, this is a high priority patient. I'm going to transport immediately. I'm going to attempt to obtain a sample history. Is there anyone around?
There are no witnesses.
The patient is unresponsive, so I cannot obtain a sample history. Now I'm going to begin my rapid trauma assessment. So the first thing I'm going to do is I'm assessing the scalp and ears for any kind of decap BTLS, any abnormalities, any cerebrospinal fluid, any crepitus. So I'm just going to palpate and visually inspect the ears, the scalp, the forehead here, the eyes. All right, I'm assessing the cheeks, assessing the nose, looking for any crepitus, any abnormalities, decap BTLS. Decap BTLS, that's deformities, contusions, convulsions, abrasions, avulsions, punctures, penetrations, burns, lacerations, tenderness, and swelling. You may have to say that for them. I didn't, but you might. So you're going to palpate the cervical spine here. Notice looking for any abnormalities, any crepitus. You're going to look for any tracheal deviation or any JVD. And then you're going to examine the chest. Looking once again for any decap BTLS, any crepitus, any abnormalities. You're also going to take the chest. Do I notice any abnormalities?
None noted.
Excellent. So I'm going to move to the abdomen over here. I'm going to palpate the abdomen in 4 quadrants. Really, now make sure there's no distension, no rigidity. Is there any abnormalities? Any decap BTLS?
None noted.
Okay, and I'm going to assess the pelvis here. I'm going to do a little pelvis rock.
You notice crepitus.
Ooh, crepitus in the pelvis. That means I'm going to immediately apply a pelvic splint.
Consider it done.
Consider done. Excellent. And that means bonus points. We're going to use a scoop stretcher to transport this patient. So I'm going to continue, and I'm going to use on 3 planes of movement, assess for crepitus right here. All right, I know that there's an open femur fracture on the other side, so I'm probably not going to check for crepitus on that leg. I'm going to check right here. And I'm going to get a pedal pulse. Do I feel pedal pulses?
You feel pedal pulse in the left leg.
Excellent. I don't feel one on the right leg because there's a trinket. So that's just noted. Do you feel anything? Do you feel anything? Can you move your toes for me? No, there's no motor or sensory functions of the patient. I'm going to do the same thing for the upper body. Start over here. 3 planes of movement once again. So I don't know if you can see what I'm doing. I'm making sure when it goes this way, when it goes this way, and when it goes this way, that there's no crepitus. There's nothing sliding there. All right, and I'm going to assess PSMs again. You always want to get a bilateral pulse here. All right, do I feel pulse?
No pulse.
All right, do you feel my fingers? Can you wiggle your fingers for me? No. So now I'm going to ask my partner to help me roll this patient onto her back so that I can assess the back. Okay, so as you notice here, we're just going to do this on a head person's count. They're going to count 1, 2, 3. On 3, you're going to roll. So when you're doing this, you want to cross arms right here, and you want to make sure your knees are far enough back so that they kind of rest on your legs. On 3, on the head person's count. 1, 2, 3. We're going to roll together, maintaining that integrity of the spine. You want to feel for the back, look, inspecting for any decap BTLS, any abnormalities, any crepitus. Inspect the buttocks. I notice no abnormalities. Do I notice anything?
None noted.
Excellent. So I'm going to roll the patient back onto her back. And I would put her on a scoop stretcher. Thanks, partner. Don't need anything. So I would put the patient on a scoop stretcher. Now, it is optional for you to put a seat collar on. We obviously have that available. So you can do that basically at any point. However, as long as you have a patient maintaining stability of the spine, you have someone holding that C-spine, according to National Registry, you're fine. So that's your prerogative. So I place this patient on a C collar.
Consider it done.
Consider done. That's a C color right there. We practiced that in other stations, so we're not going to focus on it right now. Now I'm going to assess the vitals of the patient. I'm going to get a pulse. Carotid, we know that there's no radial pulse.
The pulse is still weak, thready, and at 60 beats per minute.
Weak 30 and at 60 beats per minute. And what is the respirations rate? What is the quality of the breathing?
Respirations are now 20 breaths a minute and via bag valve mask.
Excellent. Okay, so now what is the blood pressure?
The blood pressure is 80/50.
80/50. So those are the only three. Those are the only three vitals you need for national registry. We obviously do more here at Tim, but that's what we're going to focus on right now. So I'm going to manage any secondary injuries. So if I notice any dark red oozing, dark maroon and oozing bleeding, I'm going to go ahead and put a dressing on that.
Consider it done.
Excellent. And if there was anything else that was secondary, I'm going to focus on that. So I'm going to reassess this patient every 5 minutes. This is a critical patient. I'm going to assess all the major interventions and get vitals once again en route to the hospital. And my station is complete.
Congrats.